In this video, we will be studying about external oblique muscle, the origin and the insertion of the external oblique muscle and its innervation and the actions. So first, how the external oblique muscle is originating. It is originating from the lower 8 ribs. Lower 8 ribs will be like from the 5 fifth rib to the 8th, fifth rib to the 12th rib. So they are divided into three fibers: upper fibers, middle ones, and lower ones. Or we can say anterior, lateral, or lower ones. The upper fibers will be originating close to the cartilages, then the middle ones at some distance from the cartilages, and the lower one are close to the apex of the cartilage. Okay, so like this it will be originating, that is from the increasing distance from the cartilages. Then they will be descending downwards. The lower fibers will be passing almost and vertically downwards, and will then the middle and the upper fibers will be passing downwards and forwards, means they will be going anteriorly. And then what is the insertion? So the anterior or the upper fibers originating from the fifth to the eighth rib, they will be interdigitating and forming the linea alba. Okay, and anterior fibers and lateral fiber will be interdigitating, passing downwards and forwards will be interdigitating with the serratus anterior muscles. That is, lateral fibers from the ninth rib interdigitate with the serratus anterior, and then the lowest fibers, that is 10th to 12th rib, they will be interdigitating with the latissimus dorsi. And the middle fibers or the lateral fibers will be inserted onto the anterior iliac spine and the pubic tubercle. And the lower fibers will be inserted over the external lip of the iliac crest, over the external lip of the iliac crest. Deepest fibers will be inserted over the pectineal line. So they form the linea alba, anterior iliac spine and pubic tubercle and external lip of iliac crest, that are the insertion of the muscle. And the vascular supply of the muscle is from the vascular supply will be from the intercostal nerves, subcostal, intercostal arteries, subcostal arteries, epigastric arteries, and circumflex and lumbar arteries. So that are the arteries which are involved in its vascular supply. Lower posterior intercostal, subcostal, superior and inferior epigastric, superficial and deep circumflex, and posterior lumbar. And the innervation, like its origin was from 5 to 12 ribs, and the innervation is from 7 to 12 thoracic nerves. T7 to T12 will be innervating it. And the action of the muscle is flexing and rotating the trunk, flexion and rotation of the trunk, and in the forced expiration, micturition, defecation, parturition, and vomiting. Basically, all the things which deal with the increased intra-abdominal pressure that are involved and are the actions of this muscle. So that was about the external oblique muscle, and there is one more diagram related to it. We will be studying that also. See, it is showing that the fibers from linea alba, then they descend downwards onto the outer crest of the ilium, and we need to understand the location of the ligaments. See, this is the lacunar ligament, and this is the inguinal ligament, and here over here we have subcutaneous or superficial inguinal ring, and here we have the conjoint tendon. So that, and linea alba, after the linea alba we have the linea semilunaris. That is what we need to remember in relation to the external oblique muscle.